So I want to give you some biology so you understand why when someone goes into being not healthy in their mouth, why that happens. So this is how we see the world. We see the world in big form. You know, we see people, we see buildings, but there's a whole other world we can't see, and that's the world of microbes, you know, small things. So, you know, actually, you know, the world is covered in microbes. You know, we can't see them, and actually we need these microbes. But there, of course, there are some good bacteria and viruses and some bad bacteria and viruses. And so what I'd like to show you is that it's the small things, and when I'm showing you some slides, it's the small things that can make someone go from being healthy to not being healthy. For the most part, all the bacteria in our bodies are in our digestive system. It should be in our and we need them there because they help us to digest our food and absorb vitamins. We also have it all over our skin and in our mouth and every place. And so, for instance, in your mouth, you have good bacteria because something is going to live in your mouth because there's food in there and there are all sorts of nutrients in there. But the bacteria that we have in our mouths are healthy bacteria that belong there. So how do we get good bacteria? We get from our mothers. You know, when you're in your mother's womb, when babies are in their mother's womb, there aren't really any bacteria in there. But we need to get this stuff when we're born. So how do we get it? Well, just through the birth process, going through the birth canal, we pick up good bacteria from our mothers. And then when your mother looks at you and puts her finger in your mouth and you're getting the kind of bacteria you should be getting, we pick it up from our environment. The other gift your mother gives you is that for the last 3 months of the pregnancy, there's a surge of antibodies that is given through the baby through a placenta, and these antibodies give you what's called passive immunity. So you're coming out, because the world is a dangerous place, you're coming out to the world already with some antibodies provided by your mother and the good bacteria. So yeah, so the world is trying to get in, and our bodies have developed ways of keeping us from getting sick. Most important is really actually our skin. Intact skin keeps, you know what happens when you get a cut or something like that, and it keeps you from getting infected. But also, bacteria can get in our mouths, can get in our ears. Our eyes have things and to keep you from getting an eye infection just from the tears, you know. So we have natural defenses. So, for instance, what happens when something breaks these defenses? So let's say you cut your finger. So what happens when you cut your finger? What do you see? It gets red, bleeding. It gets kind of puffy, right? Because that's your body's, it starts inflammation. So just something as little as a cut finger can start you to get an infection in your mouth, right? Excuse me, in your finger. So what about this? This is the most dangerous animal on earth, is a mosquito. And why? Because a mosquito is sucking blood, and the blood is used by these are all female mosquitoes that take your blood. They use to nurture the eggs, the proteins in the blood nurture the eggs. So the reason I'm showing you this is to show you that something just as small as a mosquito can cause malaria, and malaria kills about 500,000 people a year, you know? So, right, so something as small as a little mosquito bite, you know, can get you. So this is a very important slide. And the reason I'm showing you this is to show you how people get mouth infections. So of course, this is a tooth over here. And I want to draw your attention to this side of the picture here. So this is a gum that's tight against the tooth. Okay, so that's part of the natural barrier, like skin, you know. So for instance, I can't put my whole hand down my collar here because it's kind of tight around me. Well, this is an actual connection of your gum to your tooth. So in a healthy mouth, someone who takes care of their mouth and is able to take care of their mouth, the good bacteria are living on the teeth, and it's a disease state. Now let's say someone is not able to take care of their mouth. They can't brush their teeth, there's food on there all the time. I'll draw your attention to this side over here. So what happens is this is a show like this bad bacteria, plaque that's on there. So what happens is the gum starts separating from the tooth. So now instead of having this tight area where the gum is attached, you now have a loose floppy area. And now the bacteria, the bad bacteria, can get down into your body. So now, just like when you had a cut finger and it gets hot and swollen and red, your gum over here is hot and swollen and red. And just like with the mosquito bite, where you get an infection that goes into your general body that can hurt you, the bacteria can get into your circulatory system and can infect you. What can happen if this? So you can get certainly an infected mouth, but did you know that it can infect the rest of your body? So believe it or not, it is a contributing factor in diabetes, in heart disease, cardiovascular disease, Alzheimer's, rheumatic diseases such as joint diseases, and respiratory diseases. So you wouldn't think that somebody having a not healthy mouth could do that, but I'll show you how that works. So with diabetes, of course, with diabetes, you have trouble controlling your sugar. And when there's trouble controlling your sugar, it changes the content of your saliva. It makes it more sugary, and it makes this food for bacteria to live on. Also, it causes inflammation products. And people who have diabetes, sometimes they'll lose their toes or their feet and stuff because of circulatory problems. So having a bad mouth can cause diabetes to get worse. And I'm showing you this slide here because I'm going to be showing you some slides of unhealthy mouths. It's maybe a little disturbing, but I'm going to tell you that this is something I saw every day in my practice, and this is something every dentist sees every day in their practice when an older person or anybody who can't take care of their mouth or is neglecting their mouth comes in. And what's happening here is that the gums are swollen, they're red, there's food on there. And if you take the time to look in your client's mouth, I suspect that some of you, might be seeing that. So how does it affect your heart? So what happens is that I showed you that image of the bacteria getting down into the body from the gum. What happens, it goes into your circulatory system. This is what this is over here, it's pipeline, and it goes to your heart. And you've heard of, of course you've heard of heart attacks and hardening of the arteries and atherosclerosis. The inflammatory products and the actual bacteria can get in there and go against the vessels of the heart and cause it to be rough, and then it builds up not dental plaque but heart plaque, and then you get a blocked artery, and that's how people can get a heart attack. And it can cause strokes, and it's a contributing factor to our Alzheimer's disease. And I'm sure many of you are treating patients who have some kind of Alzheimer's or cognitive problems. Well, again, most people don't know this, but the inflammatory products and the bacteria, they've actually found bacteria in brain or products from that, and that can contribute, it's been shown to contribute to the formation of products in your brain that can lead to Alzheimer's disease. And this is a tooth over here with bacteria, gets into your bloodstream, and it causes your body to have a reaction against the bacteria, which causes bad antibodies to form, and it could actually make you have inflamed joints. So people who have inflamed mouths can get inflamed joints. And finally, lung disease. So you might say, how can you get lung disease? So this is again, sorry if this bothers you a little bit, but this is something that you will be seeing if you look in people's mouth. This is somebody who has not have the ability to take care of their mouth. So now, instead of having the healthy bacteria that you get from your mother and from the world, you now have a condition known as dysbiosis, that is unhealthy bacteria. These are really nasty germs that are in your mouth, and what can happen is that, when you're breathing right now, you're breathing in bacteria. And your lungs have the ability to get rid of it because they have something called cilia, like little things that kind of get products and things out of your lungs, also contaminants. By the way, if you're a smoker, these little cilia get kind of paralyzed, and that's one of the reasons people get lung disease. But what happens is that now if you're breathing in these dysbiotic, these pathogenic bacteria, these get into your lungs. And you may have heard something called aspiration pneumonia. It's pneumonia. As you know, that's a big problem with older folks in nursing homes or in home care situations. So aspiration pneumonia is when Something gets into the lung that doesn't belong there and causes an infection. And in this case, what's going on is that sometimes even pieces of food or certainly pathogenic bacteria get in there and can cause lung disease.